Hello everyone, good morning. Welcome back to Morning Rounds. It's Dr. Ruddy. I thought today I would speak to you about some of the things that I think you might want to know about breast cancer. Some of them you may have heard of, some of them you probably have not heard of. In any case, this is going to be a 50 bullet point list of the things that I think you might want to know about breast cancer. I'm going to be reading from my list, so I apologize that I've not committed them to memory. Number 1, exercising for 20 minutes a day, 4 days a week, reduces the risk for breast cancer 30 to 50%. Number 2, exercising for 20 minutes a day reduces the risk of breast cancer recurrence by approximately 50%, which is to say, women with breast cancer who walk for 20 minutes 4 times a week have a 50% improved overall survival. 3, eating 2 prunes a day has been shown in animal models to reduce the risk of cancer and the growth of cancer that is caused by the virus. Number 4, eating an ounce of walnuts every day in animal models has been shown to reduce the risk and growth of tumors caused by the virus. 2 prunes a day, 1 ounce of walnuts. They're very healthy. What's not to love about that? Number 5, breast cancer is the most common malignancy in dogs. Number 6, breast cancer in dogs is virtually identical to breast cancer in women. Number 7, the most aggressive form of breast cancer, triple-negative breast cancer, is 3 times more common in cats than it is in women. Number 8, the breast cancer virus is associated with between 40 and 94% of human breast cancer, but it has also been found in men and women with non-Hodgkin's lymphoma. In fact, in mice, the breast cancer virus causes non-Hodgkin's lymphoma in the males. Number 9, hormone replacement therapy, as it is produced by the pharmaceutical industry, increases the risk for breast cancer. Now keep in mind that the hormone replacement therapy that is sold by the pharmaceutical industry is not identical to the hormones that are naturally made in women. Number 10, bioidentical hormone replacement therapy are drugs that are compounded by a special pharmacist, and they are identical to the hormones that are naturally made in a woman's body. These hormones, as been shown in several studies, do not increase the risk for breast cancer. As a matter of fact, in several large studies, bioidentical hormone replacement therapy actually reduces the risk for breast cancer, even in women who've had the disease. I have to say, I was skeptical, but I've seen the study. The data begin to speak for themselves. Number 11, less than 1% of all of the money that is spent in this country on breast cancer every year, and by my estimate, that's somewhere in the range of $20 billion a year. So less than 1% of that amount of money is given to understand the causes of breast cancer or to try and prevent the disease from forming in the first place. That is called primary prevention of breast cancer. Number 12, at least 30% of all of the breast cancer that occurs in this country today is preventable using known and proven risk reduction strategies. So everyone is very clear what we could do to prevent 30% of breast cancer. Nonetheless, less than 1% of that 20 billion is spent trying to do so. That doesn't add up. Number 13, being overweight increases a woman's risk for breast cancer. Number 14, the 2 factors that seem to increase the risk for breast cancer in women who are overweight are the increased insulin levels that are associated in women who have obesity or who are carrying excess weight. Insulin has been shown to drive the growth of premalignant and malignant tumors. And the second factor is that in the postmenopausal patient, a large number of women produce excess amounts of estrogen in their fat. So this excess weight becomes an estrogen factory, and we know in many studies that estrogen drives the growth of breast cancer. Number 15, the ketogenic diet has been shown in animal studies to reduce the risk for cancer, and in fact has been used in some studies recently to treat cancer. Number 16, the human papillomavirus, which we know causes cervical cancer, has been found in cases of breast cancer. Number 17, the use of oral contraceptives, birth control pills, increases the risk for breast cancer in premenopausal women. Number 18, in 2007, the World Health Organization classified birth control pills as Group 1 carcinogens known to cause cancer in humans. Number 19, the risk for breast cancer that is seen in women who use oral contraceptives increases for up to 10 years after they stop taking the pill. Number 20, women who wait until after they are 35 years old to have their first babies have an increased risk for breast cancer for the following 2 years. Number 21, and this was very interesting, women who have been treated for breast cancer and who then go on to deliver full-term babies, so women with breast cancer who are treated, are free of disease, and have a full-term pregnancy following their treatment, have a reduced recurrence for breast cancer and an improved survival. I presented these data when I was a fellow at Memorial Sloan Kettering, and you can imagine that produced quite a robust question and answer and conversation after my presentation. Number 22, removing all of the lymph nodes under the arm when a woman is having a mastectomy does not improve her survival. Number 23, if a sentinel node biopsy does not alter a woman's treatment for breast cancer, then it is wise to consider whether or not that lymph node actually needs to be removed. To perform a procedure or to order a test that is not going to change the treatment of a disease needs to be evaluated completely, because we already have too many tests and too many procedures that we do not need. Number 24, drugs that increase a woman's bone density appear to help protect her from bone mets in cases where she has breast cancer. So the stronger your bones are given these drugs, the less likely the cancer is to spread to those bones. Number 25, breast cancer is diagnosed in a woman somewhere in the world every 20 seconds. Number 26, somewhere in the world, a woman dies of breast cancer every minute. Number 27, breast cancer is the most common female malignancy in every country around the world, bar none. Number 28, the incidence of breast cancer has increased 300% since 1970. The war on breast cancer, the war on all cancer, was declared in 1971. That has not had an impact on the increased incidence of cancer. Number 29, breast cancer survival has increased 25% since 1970. So the incidence of breast cancer has increased 300%. The improvement in survival has increased 25%, a fraction. Number 30, overall survival for stage 4 breast cancer has not budged an inch in the past 40 years. Number 31, the world's first preventive breast cancer vaccine developed at the Cleveland Clinic by Professor Vincent Tuohy in 2010 specifically targets triple-negative breast cancer. Number 32, triple-negative breast cancer is the most common malignancy in women who carry a BRCA mutation, women like Angelina Jolie. Number 33, the majority of men who develop breast cancer carry a BRCA mutation, predominantly a BRCA2 mutation. Number 34, the breast cancer virus has been found in the majority of men with breast cancer, proving the point that there's no law that says you can't have two bad things happening to you. Number 35, a large portion of women with breast cysts have been found to have evidence of the breast cancer virus in their cyst fluid. Number 36, areas in the world that have low rates of breast cancer also have low rates of the species of mice that carry the virus. Number 37, at least 30% of women whose breast cancers have been diagnosed by mammogram screening are found to have cancers that are not life-threatening and that in a large retrospective study probably did not need to be treated. The problem is, this is item number 38, that at the present time we have no idea who those women are. So we must treat 100% of the women whose cancers are diagnosed by a pathologist when he looks at the specimen under the microscope. We must assume that those women have life-threatening cancer. We must treat them fully. Number 39, the incidence of breast cancer in the United States fell dramatically when the use of hormone replacement therapy began to decline. Number 40, the women who have the highest risk for breast cancer are women who have already been treated for breast cancer. Number 41, the majority of women diagnosed with breast cancer, that is at least 85% of these women, have no known identifiable risk factors. Number 42, even though having a positive family history of breast cancer is a strong risk factor for the other women in the immediate family, the majority of women who are diagnosed with breast cancer have no family history. Number 43, vigorous physical activity and an ideal body weight for girls who are adolescents reduces their risk for breast cancer as they grow older. Number 44, breastfeeding reduces the risk for breast cancer in women who choose to do so. Number 45, even though the breast cancer virus has been found in 5% of human breast milk, the acidity of the gastric acid destroys the virus in humans. This is not the case in mice. Number 46, scientists in Italy, Saudi Arabia, and Israel reported finding the human breast cancer virus in human saliva, and they propose that this is the way the virus is passed in the human population. By the way, those same scientists have developed an effective preventive vaccine against the virus in mice. They have developed a screening test for evidence of the virus in mice, and they have developed a targeted therapy that has been shown to be effective in preventing the breast cancer that's caused by the virus in mice. Number 47, at least 70% of women who are diagnosed with inflammatory breast cancer, both here and in the United States, have evidence of the breast cancer virus. Number 48. Did I say 47, 48? I don't believe I've lost count. This is number 48. Professor Vincent Tuohy of the Cleveland Clinic has received a $5 million grant from the Department of Defense to conduct a phase 1 study of his vaccine in women. Remember that Dr. Tuohy's vaccine is the first preventive breast cancer vaccine. It specifically targets patients with the triple negative breast cancer. These are predominantly women with a BRCA mutation. A phase 1 study will show whether or not Dr. Tuohy's vaccine is safe for use in women. If it is safe, then a phase 2 study can begin, which will test the efficacy of his vaccine in women. I would like to remind you that in mice, Dr. Tuohy's vaccine is completely safe, and in mice, the vaccine is 100% effective in preventing breast cancer. Now, there are those who have said quite rightly that not everything that works in mice works in women. I agree, that is so true. But I will tell you this, everything that works in women first worked in mice. Number 49, the first case of breast cancer was reported in Egypt 3,000 years ago. And like every other country in the world, breast cancer is the most common female malignancy in Egypt to this day. Number 50, leaving aside the need to treat thoroughly and adequately every woman who is diagnosed with breast cancer, from a public health point of view and as a healthcare leader, I would like to close this list of 50 important things that you need to know about breast cancer by saying that we can no longer afford to try and find a cure for a disease that we can prevent. Thank you so much. Thumbs up to you. Thumbs down to breast cancer.